Have you ever considered the keto diet? Well, I'm Dr. Blake, the cooking doc, and I'm a kidney doctor. And I hear this question all the time from my patients: is the keto diet safe for their kidneys? Well, stay tuned. I'll give you my best answers, most straightforward answers, most scientifically based answers. Here goes. Make sure you subscribe to my channel. Click the subscribe button, hit that bell. Never miss a new recipe or a new health tip. Okay, now, before we go any further, there are two things you got to know about me. First, though I'm a kidney doctor, I am not your doctor. So I am not giving you any medical advice, and any changes that you make should be discussed with your doctor or your dietitian. Second, before we talk about the keto diet, here's my biases. I believe that any diet that you go on should be something that you can stick with for the long term and provides long-lasting health benefits. The keto diet is a high-fat, low-carbohydrate, moderate protein diet that puts your body in a state of something called ketosis. When your body gets into ketosis, it tends to burn your fat cells for energy, and that causes you to lose weight. So a typical keto diet usually uses high-fat foods, things like meat and butter and high-fat dairy, fatty seafood, creamy sauces, those kind of things that you almost never see me talk about on my show. Those are the staples of the keto diet. Now, you're allowed some vegetables. They say vegetables that grow above the ground, but basically it's vegetables that are low in carbohydrate, like cabbage and lettuce and spinach. Those kind of things are okay. At the same time, you'll limit foods that are high in carbohydrates, like breads, pastas, starchy vegetables, legumes, beans, a lot of fruits. Some of the things that I often cook on this show are limited in the keto diet. The restrictions for the keto diet are very strict. So if you want to keep your body in that ketotic state where you're losing weight and burning fat, you really can't stray. So you have to specifically eat only those things that are allowed, and do not cheat at all with the foods that are not allowed on the keto diet. That can create a stressful situation and a diet that's hard to live with for the long run. Chronic kidney disease means that your kidneys do not function properly. Either they don't filter properly, or you're missing part of one kidney, or you're leaking protein in the urine. All of that falls under the heading of chronic kidney disease. And chronic kidney disease can range from mild, stage 1, where there's very little symptoms or no symptoms at all the way to stage 5, which is the level right before you need a kidney transplant or you need to go on dialysis in order to survive. Obesity, diabetes, high blood pressure, these are all the biggest risks for somebody developing chronic kidney disease. So it makes sense when people come and see me in the office, they say, well, if you don't want me to get kidney disease, or if you don't want my kidney disease to get worse, I know I'm supposed to lose weight. So I get questions about paleo diet, intermittent fasting, veganism, all these things as they relate to how it will affect somebody's kidneys. Recently, though, almost all the questions have revolved around the keto diet. Let's start with the safe aspects of a keto diet and the similarities between a keto diet and a kidney healthy diet. These are aspects of any eating pattern that will certainly lead to better health. Avoiding ultra-processed, high-carbohydrate foods like chips and pretzels and cookies and cakes, all that stuff is not allowed in the keto diet. It's also not allowed in a kidney healthy diet. It's also not allowed in any other restrictive diet. Next, avoiding sugary drinks. So sodas, fruit juice, sweet teas, sweetened coffee drinks. No-nos for the keto diet, no-nos for a kidney healthy diet. All those things will increase your risk of obesity. Eating low carbohydrate vegetables. As the cooking doc, I love these vegetables: broccoli, cauliflower, spinach, and they're also allowed on the keto diet. The differences and potential dangers when somebody with chronic kidney disease wants to go on the keto diet stem mainly around the protein intake. A typical keto diet recommends between 1.2 and 1.7 grams of protein per kilogram of body weight per day. And there's really no distinction made between the animal protein and the plant protein. Now, if you have normal kidneys, I think the jury is still out as to whether a protein intake at that level will cause long-term kidney damage. People with normal kidneys may be able to handle that amount of protein for a lot of years without causing any problems with their kidneys. But if you have chronic kidney disease, that means that you already have kidneys that are somewhat damaged. And if you have kidneys that are somewhat damaged, we know that a lower protein diet benefits your kidney health in the long run. So what am I talking about on that lower protein diet? I'm talking about a level between 0.6 and 0.8 grams of protein per kilogram of body weight per day. Those are the most recent recommendations that people with kidney disease lower their protein intake to that level. Simply put, the more protein that you eat, especially animal protein, the more work that your kidneys have to do to process that protein and get rid of the toxins in your urine. And the thought is that as those kidneys are working to get rid of that extra protein, they're doing what's called hyperfiltering. They're doing extra filtering. And that extra filtering over periods of years and years can cause the filters in the kidney, which are known as the glomeruli, to become scarred down. And when you have glomeruli that are scarred down, your kidneys are not able to process the toxins and do the job that they normally do. And that, over time, can lead to worsening kidney function. So while the keto diet isn't an enormously high protein diet, it still recommends twice as much protein as we suggest somebody with kidney disease have during their day, especially if they're in stage 3 or 4 or 5 chronic kidney disease. Other things to be cautious of if you're thinking about a keto diet and you have kidney disease is the sodium intake. Oftentimes at the beginning of a keto diet, they will recommend a higher sodium intake to help your body adjust to eating fewer carbohydrates. And in people with kidney disease, we usually recommend a lower sodium diet. I also have a little bit of concern about the carbohydrate intake itself. In people with kidney disease, we often recommend carbohydrates because they allow somebody to get energy from their food without exceeding their daily protein intake. So carbohydrates are an integral part of a diet for people who have chronic kidney disease. Most of the research on kidney stones and the keto diet has been done in children because the keto diet was initially developed as a way for people with refractory epilepsy, kids with refractory epilepsy, to lower the number of seizures that they're having. And it appears to be effective for that. So there are a lot of studies done on those kids and whether or not they develop more kidney stones. But there are very few studies done on adults. So we don't know for sure if adults who go on the keto diet have a higher risk of kidney stones if they're going on the keto diet for weight loss. What we do know is that diets that are higher in animal protein and higher in salt sometimes increase the risk of kidney stones for a lot of people. So you could think that the keto diet may increase the risk of kidney stone, but we don't have any studies to say that for sure. While the data is still coming in on the risk and benefits of a long-term diet, I believe that there are still too many unknowns to recommend it to people with chronic kidney disease, especially as you get to stage 3, 4, and 5. Just because I don't think that a keto diet is right for people with chronic kidney disease at this time, doesn't mean that I don't think things will change in the future. We're still getting new studies in, and there may be areas for overlap between the two. So what am I talking about? What about a vegan keto diet? It's a diet that you don't have that animal protein, but you're still having a higher amount of plant protein that's typically recommended in a chronic kidney disease diet. Is that something that would help people lose weight and lower the risk of chronic kidney disease? I don't know. If somebody doesn't have any risk factors for chronic kidney disease, what does the keto diet do to their risk over the course of 10 to 20 years? Does it increase their risk of kidney disease? Does it increase the risk of kidney disease and heart disease? Does it lower the risk of diabetes? These are questions I think that are still to be answered. Thanks so much for watching today. Make sure you go over to my website, thecookingdoc.co, for lots of health tips and recipes. Some of my recipes are low carbohydrate, some of them are higher carbohydrate. They're all good for you. Lots of vegetables, vegan options, all kinds of things. I encourage you to read more. Let's find out longer term about what diet is best. From my point of view, any diet that you can stick with that's proven to have long-term benefits is probably the one for you. You've also got to be able to enjoy your food and live your life without every minute of your day thinking about what you're going to eat. We'll see you next time.